here to run through an abdominal assessment and kind of highlight some of the features that students might have difficulty with. The first thing you want to do after washing your hands, introducing yourself to your patient, is inspect the abdomen in the abdominal area. So the first thing I want to do is check my patient's demeanor and whether she's in any apparent distress. My patient's very calm right now. She doesn't appear to be in any distress. So what I'm going to do is move on to contour. So what I'm going to do is check the symmetry and contour of my patient's abdomen. And what I'm looking for here is whether the abdomen is flat, scaffold, or concave shaped, whether it's rounded or bloated and maybe towards the bowels, or whether it's protuberant, maybe if my patient were pregnant. A good way to do that is to get down eye level and really see. And I can tell right now that my patient's abdomen is flat. So the next thing I'm going to do is inspect the movement of my patient's abdomen. Now what you are looking for with this is peristalsis in the bowels. That can be very difficult to see, but it's definitely something you want to look for. Also, pulsations of the aorta can be seen sometimes in thin patients who are very relaxed. The next thing I want to look for is skin. Now, when you're inspecting skin, you want to look for scars, rashes, bruising, birthmarks, moles, anything that might be different. Also, you want to assess the color of the skin. My patient's color looks great. There's no real scarring or anything on my patient. So what I'm going to move on to is hair distribution. Now, it's normal to have hair on the abdomen, especially coming at midline to the umbilicus. That looks great with my patient. Nothing that would alarm me to signal any abnormalities. Also, I want to inspect the umbilicus. Hers is inverted. The color is the same as of the skin around it. One thing you want to be careful, have a careful eye for, is umbilical herniation, and that's going to evert the umbilicus, and that can be a problem, so you want to check for that. The next thing we want to do in our abdominal assessment is auscultate. Now, one thing you want to remember that's particularly important with abdominal assessments is you want to move from least invasive to sort of most invasive. We started with the inspection, now I'm going to auscultate. I don't want to palpate and get all of her bowel sounds moving and more active than they are naturally. So like I said, now we're going to auscultate. So we're going to start in the patient's lower right quadrant and move clockwise. We do this to follow the natural progression of her bowels, so the ascending, transverse, and descending colon. So you want to listen in each quadrant for hypoactive, normal, or hyperactive bowel sounds. You want to make sure you hear them in all the quadrants, and if you think that they're absent, that's a medical emergency and you need to listen to the bowel sounds for 5 minutes before you determine that they're absent. So my patient's bowel sounds were hyperactive, which is fine because she's hungry. So the next thing I'm going to do in my assessment is listen for bruits, which is turbulence of the blood through the vascular spaces. So what we're going to do is start with the aorta. Then I'm going to move to the renal. And then the femoral. Following auscultation, we'll begin to percuss. I'm going to percuss in the 4 quadrants of her abdomen, and I will demonstrate that for you now. on my patient was general tympany throughout, which is normal. Tympany is the sound of air rising up because my patient is laying in supine position. One thing I would be listening for otherwise would be dullness, which might reflect fluid or a mass. Also, if it was hyperresonant, that could be an indication of gastric distension or extra air. The next thing I'm going to percuss is the liver span. What I'm going to do is start at the top towards the lung field, and I'm going to percuss down until I feel dullness, which would mark the top border of the liver. So I hear dullness right around here, so this is going to mark the top border. So what I want to do is start towards the bottom, mid-clavicular. Okay, so I hear dullness right here. Remember, it was tympanic throughout here and then dullness. So this is the area that marks the liver span. I can see that it's between the normal ranges of 6 to 12 centimeters, which is great. Now I'm going to have my patient sit up, and I'm going to test for CVA tenderness. Now what you want to do is place your hand along the 12th rib line. Place a hand and then give it a little pound. Now what you're checking for is kidney inflammation, and if I had done this and my patient's kidneys were inflamed, they would feel very severe pain and it would be obvious. But my patient seems to be fine. The last thing we're going to do for our abdominal assessment is palpate. So I'm going to palpate in all 4 quadrants, starting with lightly first to make sure that it is not discomforting to my patient. Tell me if you feel any pain or discomfort. Okay, next I'm going to do that a little more deeply, and I'm going to ask my patient the same thing. Please let me know if you feel any discomfort or pain. Now what I'm doing here is trying to feel for masses or lumps or any abnormalities. Also, it's really important to know if that is discomforting to the patient or not. The patient seems to be fine. The next thing I'm going to check for is rebound tenderness. Now what I'm going to do is in the lower left-hand quadrant, press really deeply and lift up quickly. And if my patient has an inflamed appendix, what that's going to do is cause a lot of pain in the right quadrants. That's why it's called rebound tenderness. Following rebound tenderness, there are 2 other exams we can perform to test for appendicitis. A positive result in either one of these would be sufficient, but we're going to go through both of them. The first one is called the iliopsoas test. What I'm going to have my patient do is flex her hip, bring her leg up, and I'm going to push down on the lower part of her thigh. Is that painful? No, it is not painful. If she were feeling pain, it would be in her right quadrant, and it would be due to the inflammation of the appendix causing inflammation of the peritoneum. So we're going to check the other one that checks for the same thing. It's called the obturator. Have my patient flex her hip again and bend her knee at 90 degrees. I'm going to hold onto her ankle, and I'm going to rotate internally and externally. Is this painful? No. Great. The last thing we're going to test is going to be for gallbladder inflammation. It's called Murphy's sign. What I'm going to do is put my fingers right under her rib cage, and I'm going to have her take a deep breath in. And it would be painful upon inspiration. And if it were, then there would be an inflamed gallbladder.
All right, this is the conclusion of our full abdominal assessment. We hope this piece of health information technology can help you in your studies.